So this level 0 session is designed to provide an overview on what larval therapy is and what it's used for. We'll look at what the contraindications are and how it should be prescribed, ordered and stored. So rolling right into it, let's talk a little bit about where we get our maggots from. So here at BioMonde, we use the common green bottle fly, also known as Lucilia sericata, or Lucy, as I like to call her. And we use this fly for a few key reasons. So firstly, the green bottle fly is indigenous to the UK, which means we know that her larvae will survive in the environments we put them in. Secondly, the eggs are incredibly robust, which means that we can disinfect them to a standard which makes them suitable for use in a medical setting. Thirdly, they are safe for human use, and this is because they only consume dead, devitalized tissue. So in other words, their secretions only have the ability to break down dead, unviable cells, not healthy perfused tissue. And this can be great to know if you've got a patient who is very concerned. Maybe they are wondering if they're going to be left with a huge cavity where their leg ulcer used to be. And you can also tell patients that the larvae cannot dig, tunnel or burrow into healthy human tissue, which is equally reassuring. And finally, the behaviour of the green bottle fly is really predictable, which means that we can use the same care plan for every single patient that has larval therapy. So here you can see a life cycle of the green bottle fly. Some patients or carers might be a little bit concerned about what larvae can and can't do whilst they're on the wound. And sometimes knowing a little bit about the life cycle of the fly can be useful for having some discussions and reassuring patients. It's of course very difficult to know what stage happens first, the fly or the egg, but we're going to start with the fly. So the male and the female fly will mate, and the female fly will typically lay her eggs on a food source. In our facility, she lays them on a synthetic protein, and she does that to minimize viral or bacterial contamination. And she also does this because she knows that her larvae will require nutrition as soon as they hatch and would perish without it. The eggs take around 12 to 24 hours to hatch, and we control this with temperature in our facility. So the hotter it is, the faster they hatch. And then when they hatch, the larvae are around 2 to 6 millimeters in length, and they'll grow to around 10 to 12 millimeters in length after feeding for up to 4 days. And it's worth noting at this point, it isn't possible for larvae to keep feeding indefinitely. Larvae go through 3 different growth stages before they pupate and turn into flies, and they are placed on the wound at larvae 1 stage, which is 1 day old, and they are taken off at larvae 3 stage, which is 5 days old. And after this, they would enter a post-feeding stage. And during that stage, normally they would stop producing their secretions and their skin would turn into their pupae shell, and they would pupate for around 7 to 10 days. And emerge after that, having metamorphosized and turn into flies. But as I said, this takes 7 to 10 days after the larvae start to pupate, and we take them off around when they start to pupate, so they are removed from the wound long before they ever become flies. And here you can see one of the clean rooms and our fly hotel. So for those of you who don't know, all of the larvae that are produced in the UK are produced in our facility in South Wales in Bridgend. The first picture here is an exterior view of one of our clean rooms, and each room in the facility is classed as a different grade of sterile. And the product is constantly being tested to ensure it's safe to ship out to customers. The second photo is a picture of our fly hotel, or a fly room, you might hear it called. And this is our colony of flies. It's closed from the wild, and we do this to ensure purity and sterility. There's a 3-week cycle of flies, ensuring that eggs are constantly being laid by the females. And so, as I said, they lay their eggs on the protein substitute, and then they are harvested and sterilised, and half of those larvae that hatch are sent out to clinicians, and the other half are kept back to produce the next generation. And here you can see the production team. They wear sterile outfits throughout the whole process of producing and packaging the larvae. As the process moves through each stage, the room increases in sterility as well, and the air is purified to remove any contamination. So as you can see in this process, firstly, the fly eggs are disinfected to remove any contaminating bacteria, fungi, viruses, things like that. And then the process is repeated once the eggs have hatched. And then the hatched larvae are aseptically placed into biobags. And then within 5 hours of transfer, the products leave our site and they'll arrive with clinicians the next day for use that day or the day after. So let's have a quick look at suitable wound types. You've probably seen in the past that larvae can be used on many different types of wounds, and here's just a few on the list here. So for example, pressure ulcers, leg ulcers, diabetic feet, traumatic wounds, surgical wounds. This list certainly isn't exclusive. There's lots of different types of wounds you might decide to use larvae on, but there are a few occasions when you might want to consider using other options. So here we have our contraindications, which is normal for a lot of therapies, isn't it? So for example, wounds that have a tendency to bleed or that have bled in the past or even have exposed major blood vessel involved, then you might want to consider other options, weigh up the risks versus the benefits. Remember, the larvae are selective, so they're not going to break through any viable or undamaged vessels, but obviously just take care around any vessels that you're not sure about or you suspect to be damaged, especially if they have bled in the past. If you've got a patient on an anticoagulant such as warfarin or heparin and their clotting factors aren't within therapeutic range, then again, you may want to consider other options. You could decide whether there is in fact a bleeding risk for that patient or not. Or of course, you can wait until their bleeding time is within therapeutic range again. Make sure that the wound has always got adequate blood supply so that it can go on to progress towards healing. The larvae are potentially going to create a bigger and they're definitely going to create a wetter wound. So it's important to decide whether this would pose a risk to your patient if healing didn't progress. There are some exceptions to this, and that might be if you've got a patient who's going for revascularization surgery or they're looking to support a diagnosis. Now, when it comes to internal organs, we don't really know what the larvae or their secretions would do to them. Due to their selectivity, it might not be much, but it really isn't worth the risk. So it's worth considering whether it's appropriate to treat in wounds with exposed organs or leading to cavities, especially cavities that haven't been fully explored yet. And finally, of course, if you've got a patient who is allergic to the fly, larvae, or any of the components of the dressing, such as polyester or polyvinyl alcohol foam, then do consider other options. But if you are not sure, you can always talk to us. You can always give us a ring and we will talk through the contraindications with you, and we will give the information that will help you decide whether it's suitable for your patient or not. So we talked a little bit about BioBag, but what are they? So one of the reasons BioBags are so popular is that the maggots are fully contained in a heat-sealed bag for the full duration of the treatment. The larvae don't have direct contact with the wound, but are still effective because they can pass their secretions through the net of the bag, plus they can get their mandibles through the pores of the net if they wish to. The bag is applied just like any other dressing. It's very quick to use and it's designed so that it can be removed at any point during the 4-day treatment if required. It's transparent, so the wound can be assessed through it. And as it's been proven, the contained larvae remove the same quantity of tissue as loose larvae would over a 4-day period. So it does make it a really good choice for patient acceptance. Now, the BioBags come in 5 different sizes, so all you have to do is figure out the length and the width of your wound and then choose the bag that best fits it. We always advise having a little bit of overlap over the wound margins, but you shouldn't have bags overlap each other. If there is any significant depth to the wound, that should be added to the other measurements when choosing your most suitable size. It may be that you need to choose a couple of different sizes in order to best cover the whole wound, or you may need to have a slightly bigger bag instead of a slightly smaller one in order to get the best coverage, especially over those wound margins. But it's worth knowing that BioBags can be folded. So if it is slightly too big for the wound, then you can fold it, but obviously just be careful not to fold any of the little maggots in half. So, okay, once you've identified a patient who is suitable, you've measured their wound, you've figured out what size bag or bags you want, you need to get the product prescribed. Maggot therapy is treated as an unlicensed pharmaceutical in the UK. That means it must be prescribed by a doctor, independent nurse prescriber. It could be by supplementary prescribers, but it's worth checking with your local policy. And then in the hospital setting, the pharmacist will be the one to place the order with us, and we'll always ask for the name, usually the GMC or the PIN number of the prescriber as well. And in a primary care setting in the community, the prescription should be raised by the GP or nurse prescriber and sent to the patient's community pharmacy, and then they can ring us to place the order. As you're probably aware, the maggots don't live on the shelf, they're made to order, so we need to have a cut-off time, and that's 2 p.m. Monday to Friday. And if you order your maggots before 2 p.m, you'll get them on next day delivery. And we deliver Monday through to Saturday. So if you'd like a Monday delivery, you need to ring us on a Friday and let us know it is for Monday. Otherwise, it will arrive on a Saturday. So as you can see here, the treatment cycle is roughly 96 hours. We always tend to say 4 days, with the day of application being day 0. And ideally, you apply the larvae the day that they arrive, but generally speaking, you have until midnight the next day from the day they arrive to put them onto your patient. So for example, if they came on a Saturday morning, you'd have until Sunday at midnight to apply them to your patient. So that means in theory, you could apply them any day of the week. Most deliveries arrive before midday, but if there is going to be any severe delays, then we will always contact you and let you know. And once you do receive your box of larvae, and maybe you're not going to apply them straight away, it's really important to keep them on countertops or somewhere safe at room temperature. Do not put them in the fridge or the freezer, and just be mindful of things like radiators and hot windowsills as well. So that's almost it from me. But as I said, there's always plenty of ways to get in contact with us. As you can see here, we have our clinical helpline, and that's manned 24/7. So you can always contact us there. If you've got something less urgent, you can email us, or we have a lot of information on our website. So you might just be able to find a quick answer there. But like I say, we're always around to contact if you've just got a quick question you want to ask. And don't forget, you can always follow us on social media. We put up-to-date news, behind the scenes, we put case studies, all sorts of information. We answer questions on there as well. So why not hit follow on your favourite platform?